Trend when it comes to cancer. Since the 1990s, there's been a significant increase in people under the age of 50 being diagnosed with cancer, specifically breast, colon, liver, and pancreatic cancers. Here now to put some perspective into this is Dr. Niamey Wilson, Associate Director of the Breast Health Program for the Hartford Healthcare Cancer Institute. Doctor, welcome back.
Thank you.
Are you seeing younger women being diagnosed with breast cancer as the study suggests?
We are, and it is disturbing. The study identifies women who are less than 50 as being early onset, and those being diagnosed after 50 as late onset. 52 is about the right age of diagnosis. That's the most typical age for breast cancer. But we're seeing a lot of younger women come in, and every single time it's difficult because it's just not something that's on their radar. Young women are not thinking about being diagnosed with breast cancer.
All right, and doctor, so the big question is, why are we seeing younger people being diagnosed with these cancers?
So it's a great question. It's really the patterns of exposure that this study tries to identify to explain why we're seeing young women and young people in general being diagnosed with cancer. So there are some trends that they identified. One was the trend more towards a Western diet with lots of red meat, processed food, sugar, physical inactivity. The average American sits down for about 8.2 hours a day. I personally think that there's a lot of stress that also is a big problem in terms of depression, anxiety, time spent on social media apps and computers and things like that also contribute. But the study really tried to go over a lot of key factors. And obviously screening, increased screening and better screening also contributes too.
All right, doctor, talk about how treatment for breast cancer impacts a patient when the diagnosis is made at a young age.
Yeah, so our younger patients have different considerations when they get diagnosed. For example, medications are different in terms of what we recommend for premenopausal versus postmenopausal women. For some women who need chemotherapy, if they're young, that could trigger menopause. And so for our young patients who are undergoing chemotherapy, we refer them to fertility preservations so that they can potentially be able to have children later. If someone is young, a lot of our younger patients are opting for double mastectomy. If you have a double mastectomy, you can't breastfeed because there's no breast tissue. So a lot of this impacts family planning too.
All right, doctor, and programs and services are important for cancer patients, and you have an event coming up that you want to tell us about.
Yes, so I will be there. Basically, we do a lot of fundraising. The fundraising provides critical resources for our patients who are undergoing cancer treatment, diagnosis. So Midstate Medical Center is hosting a Vegas-themed gala at the Oakdale Theater in Wallingford. That's on November 5th from 6 to 11. Tickets are available for anyone. I will be there, so you can come chat with me, and it's going to be a great evening.
All right. Well, we hope you raise lots of money and spread the word about it. Dr. Niamey Wilson with Hartford Healthcare Cancer Institute, we appreciate your time and insight with this new study.
Thank you.